Welcome to Inside 340B Report, an insightful conversation between 340B Report's editorial team on the key issues affecting the 340B drug discount program, the nation's second largest government drug program. Hello, and welcome to the latest episode of Inside 340B Report. I'm Ted Slafsky, publisher and CEO of 340B Report, and I'm joined today by Shannon Young and Will Newton, who are both associate editors and senior writers. Before we dive into the latest 340B developments, I want to let our listeners know that we're pleased to offer a special 25% discount to 340B Report first-time subscribers. You can go to the subscribe tab at 340breport.com and use the coupon code PODCAST25 to take advantage of the discount. I know you will find our new service to be a valuable investment. Also, I want to encourage you to check out 340B Report's new business area focused podcast, 340B Leaders Up Front, hosted by a longtime colleague of mine, Anna Mangum. The podcast showcases conversations with industry executives who are at the cutting edge of innovation and leadership in the 340B space. Today, we're going to discuss how one drug maker is planning to remove its medications from the 340B and Medicaid Drug Rebate programs, recent developments in key lawsuits challenging states' 340B contract pharmacy access laws, and finally, we'll look at various dark money groups' efforts to block a 340B contract pharmacy and provide a reporting bill in Michigan. Let's start off by talking about Bausch Health. The company recently announced that it will remove products from the 340B and Medicaid Drug Rebate programs. I know this is a big deal for healthcare providers and patients who rely on these products. Shannon, what can you tell us about that move and its potential implications for 340B providers?
Yeah, so in the past week, we heard some rumblings of Bausch Health quietly announcing through notices on its website that it will be removing products from the 340B program and Medicaid effective October 1st. So there's still a lot of details we don't know about these terminations. We don't know if it's going to be for all of Bausch medications, and the company hasn't responded to multiple requests we've sent them asking if that's going to be the case and just seeking comment on this decision. But we did speak to some attorneys, and Bill Von Osen, who's a principal at Powers, who's represented 340B providers since the program was enacted, told us that drug makers can't pick and choose what drugs are for removal. And that's because when a manufacturer executes a rebate agreement or a pharmaceutical pricing agreement, also known as a PPA, it obligates itself to provide the Medicaid rebate / 340B discounts on its full product line. However, Bill told us that a drug maker could sell specific national drug codes to another company, and that could be what's going on here. Again, we've reached out to Bausch Health and haven't heard if that's the case or not. But what we do know is that Bausch has filed to terminate 12 labeler codes, or these NDCs, from 340B and Medicaid. Those codes are associated with hundreds of 340B eligible drugs, most notably Xifaxan, which is a commonly used drug to treat hepatic encephalopathy and irritable bowel syndrome treatment. It's also one of the drugs selected for IRA drug price negotiations in 2027. So that I talked to a couple consultants in this space, and they said that, the fact that it's part of the IRA drug price negotiations kind of proves that it's a pretty popular drug if it got selected for that. The terminations don't really seem to affect products that are part of Bausch's eye care subsidiary, Bausch & Lomb. Kind of unclear what's going on there. I know that Bausch Health has been trying to sell Bausch & Lomb, so that could be part of what's going on there. And what this means for providers is if they can't purchase these Bausch medications at 340B prices, they might have to purchase them at WAC, which is the wholesale acquisition cost. And at least one source told us that for Xifaxan alone, that's about $3,000. And there's no generic available for that drug specifically. So hospitals, providers looking to use these drugs on patients could be spending a ton of money if this all pans out as it's supposed to. And Bausch has said that patients can utilize the company's patient assistance program, also known as the PAP, to help cover the cost of these medications. There's still some details around that we don't know. And stakeholders are raising concerns that this will create new barriers for covered entities that already face multiple manufacturer restrictions. And they're also planning for major changes under the new 340B rebate pilot model that's supposedly coming in early 2026. And they've also cautioned that other drug makers could follow suit.
That's certainly super interesting and could have some really big implications for the program. And Ted, I know that you've spoken to several stakeholders about some of their concerns with these actions. Can you tell us a little bit more about what you've been hearing?
Yeah, I've heard from a number of providers in the program, as well as some others who are part of the supply chain. And one of their biggest concerns is that it's possible that not all of Bausch Health's products that they're terminating are covered under the company's current patient assistance program. So that will be crucially important because there really will be an alternative unless all of those products, especially the expensive ones, are covered under their PAP program. And another thing that a number of the stakeholders pointed out to me is that many of their patients are not necessarily on Medicaid. They have a lot of patients who are, but the notice on the patient assistance program website for Bausch mentioned that for those who are on Medicaid, we can help you on these medications. But the providers have said to me, well, that's potentially helpful for the Medicaid patients, but how about their uninsured patients or underinsured patients? And they also point out that a number of their patients may not even qualify for the PAP because they're undocumented or just, as I mentioned, significantly uninsured. So will the company's PAP help them is what they're been asking, at least in their when they've reached out to me, and I think also to you, Shannon. So that's certainly an area of concern, one of the areas of concern. More broadly, there's a concern, as I think you mentioned, Will and Shannon, that perhaps other companies may choose to withdraw from the 340B and Medicaid and subsequently the Medicare Part B programs, because in order to qualify for coverage under the Medicaid and Medicare Part B programs, you have to participate in 340B. So it'll be interesting to see if any other companies decide at this point to be withdrawing from this program. And the problem, of course, is if patients don't have alternatives for medication, that makes it very difficult, not only for the patient, obviously, but the providers who are taking care of them. We need to all keep in mind that while drug company patient assistance programs can be very helpful and are greatly appreciated, they're often not easy to navigate. And many patients don't have the ability to fill out the paperwork or meet the requirements. So this ends up being the responsibility of 340B providers who are already swamped with their day jobs. So all of these are issues that are being raised today by various providers and others who are involved in taking care of patients.
Yeah, Ted, you make some great points about the impact it could have on providers and patients. And certainly if this trend continues among drug companies, other drug companies, that would be very, very impactful. So before we continue with our episode, we are going to take a quick moment to hear from one of our great sponsors.
Plenful is redefining how healthcare works by eliminating the operational bottlenecks that slow teams down and delay care. Built to empower 340B teams and the patients they serve, Plenful enables enterprise healthcare organizations to scale operations with speed, precision, and intelligence. Plenful's leading AI workflow automation platform powers end-to-end solutions across 340B compliance audit, missed opportunities, referral capture, and workflows, to automate reporting required by the 340B rebate model pilot. By combining deep human expertise with purpose-built AI, Plenful automates complex workflows to eliminate inefficiencies, enhance 340B compliance, and unlock critical revenue. Partnering with more than 75 leading health systems, pharmacies, provider groups, and other large healthcare organizations, Plenful powers smarter, faster, and more affordable healthcare operations. To learn more, visit plenful.com. That's plenful.com.
Switching gears, let's look at what's been happening at the court level. Will, can you give us an update on the latest in these various lawsuits challenging states' contract pharmacy access laws? I know there's a lot of action going on with these federal court cases in the states that are being challenged.
Definitely, Ted. So since our last podcast, there have been two pretty major federal court decisions related to state contract pharmacy access laws, one about a Mississippi law and another about a Maine law. Maine and Mississippi are both among the 21 states that have enacted laws that essentially prohibit drug manufacturers from placing contract pharmacy restrictions. Almost all of those 21 laws have been subject to multiple drug industry lawsuits, and we've started to see more and more rulings trickle in. Starting with the Mississippi case, basically what happened is after Mississippi enacted its law, the drug maker AbbVie and a couple others sued to block the law, arguing that it was unconstitutional. AbbVie also at a federal district court level filed a motion for preliminary injunction, which basically means AbbVie was just asking the judge to block the state from enforcing the law while the full trial played out. After AbbVie filed that motion, the judge in Mississippi at the district court level denied AbbVie's motion, said, "We're not going to block the state from enforcing the law because it does not look like you're likely to succeed on any of your claims in the case." AbbVie then went ahead and appealed that to the Fifth Circuit Court of Appeals. So our federal appeals or our federal court system, right? We have a bunch of district courts, about a dozen or so appeals courts in the Supreme Court. So AbbVie appealed it up another level. And about 2 weeks ago, a panel of 3 appeals court judges in the Fifth Circuit and New Orleans, they affirmed what the district court judge said. They said, "We are not going to let you block enforcement of the state law because we don't think you have a good chance of winning the case." That doesn't mean the case is over. That just means it goes back to the district court level. The full trial will now play out, but Mississippi is allowed to enforce the law, and it's back before a judge who has already said that they don't think AbbVie is likely to succeed in the case. And that's where we are in Mississippi. And then in Maine, what happened is after Maine enacted a similar contract pharmacy access law earlier this year, there were several drug industry lawsuits. AbbVie and Novartis both sued earlier this year and also filed motions for preliminary injunction. A federal district judge in Maine denied both of those motions, said, "We're not going to block the state from enforcing the law." So the full lawsuits are going to play out, and Maine is allowed to enforce its law. And Maine's law actually just took effect on September 24th, and the decision came out the day before. So that is very important for that state. Novartis has already appealed the decision. It remains to be seen whether AbbVie will as well. And so this is, another case where the ruling has gone against the drug industry, but the cases aren't entirely over. And now stepping back from some of the kind of technicalities in these two recent cases and looking at the overall landscape right now, as I said, there are several dozens of ongoing lawsuits. And so far now, 2 federal appeals courts, so the 8th Circuit and the 5th Circuit, have now sided with the states and ruled against the drug industry. And we're actually up to 7 different federal district courts that have also issued rulings siding with the states and against the drug industry. So that would be Arkansas, Louisiana, Mississippi, Maryland, Missouri, Tennessee, and now Maine. And then there is 1 federal district court in West Virginia that sided with the drug industry and went against the states. Again, as I said, with the exception of Arkansas's, almost all of these cases are still ongoing or under appeals, etc. But from what we've seen in these rulings, judges are pretty overwhelmingly going with the states so far. That said, it does appear that the drug industry's strategy is to try and get what's called a circuit split, which is where they basically get two different federal appeals courts to issue different decisions on the matter. And typically when this happens, when you have two federal appeals courts that have said different things about the same issue, that increases the chance that the Supreme Court actually takes up the issue. And so, with all of these cases siding with the states so far, if they can just get one to go at the appeals court level to go against the states, that ups a chance of a Supreme Court review. And that's certainly what they're trying to do in West Virginia and in any number of these states. So that is something that we are very closely watching.
Thanks for that recap, Will. And speaking of state contract pharmacy access legislation, this week we've seen some debate unfold in Michigan over lawmakers' efforts to enact a contract pharmacy and reporting bill in that state. Will, can you tell us what you've heard from your reporting there?
Yeah, Shannon, what's happened in Michigan has been super interesting. And we have covered so many of these bills, especially earlier in the year. But the Michigan situation is pretty unique for a couple of reasons. First of all, it's a purple state. So the House has a very narrow Republican majority. The Senate has an even slimmer Democrat majority. So far, the bills we've been seeing, most of them have been in very red states, and then a couple as well in very blue states. But we haven't really seen this purple state dynamic yet. The bill itself is pretty interesting, and I'll get into that in a minute. The reporting requirements are pretty unique. And then, as Ted alluded to earlier, there's been some dark money attacks, and there's also an ongoing feud between the State Hospital Association and the Republican Speaker of the House. So quite a bit happening there. To start out with the bill itself, it's pretty standard contract pharmacy access provisions. It prohibits drug makers from restricting the delivery of 340B drugs to contract pharmacies. And it also has reporting requirements for hospitals and reporting requirements for manufacturers, which is pretty unique. The bill basically, if manufacturers raise their drug prices by a certain percentage any given year above the rate of inflation, then they have to report additional information about their costs. This bill was introduced recently by a Michigan Republican who is the chair of the Michigan House Policy Committee. It's pretty similar to a bill that the Michigan Senate very overwhelmingly passed in March. The key difference being the Michigan Senate bill, the reporting requirements applied to all covered entities. Michigan House bill, they only apply to hospitals, but the reporting is happening through the Hospital Trade Association, and it's totally aggregated, meaning you would get information about the total 340B purchases, total 340B savings across the state, but you wouldn't get that data sorted by individual hospitals. So that's a key difference. It also, the Michigan House version has a provision that's specifically requiring hospitals to use their 340B savings to benefit their community in pretty broad terms. That's the difference with the bills there. And we had a hearing earlier this week, and the hearing itself was pretty standard in that providers representing hospitals and health centers across the state were very strongly supporting it. The Hospital Association has said that, they see these transparency requirements as good and view it as a good compromise, and they're willing to do some additional reporting and really value the contract pharmacy aspect of it. And then the drug industry sent several reps as well from pharma and AbbVie who are very strongly opposing it. There is also a patient advocate group and a free market nonprofit that also opposed the bill. So that was pretty straightforward. But then where it gets interesting again is what's been happening behind the scenes. And the Speaker of the Michigan House, Matt Hall, has really had this feud with the CEO of the Michigan Hospital Association. And it looks like it all started when the the CEO of the Michigan Hospital Association wrote an op-ed criticizing the Medicaid cuts that were part of the reconciliation law, also known as the One Big Beautiful Bill. And after that op-ed came out, the speaker has been accusing the Hospital Association of being partisan, of being Democrat, and has also accused hospitals in the state of quote unquote crying wolf on every issue, and suggested that he doesn't really believe that they need this 340B legislation because he's accusing them of crying wolf on issues. Now, after the speaker made those comments, which were at the very end of August and the beginning of September, right before this hearing, this dark money group called Building America's Future, that if you've been listening to the podcast, you're familiar with, they basically started this ad campaign. They quoted Speaker Hall talking about hospitals crying wolf, said he was standing up against hospitals and stopping the expansion of 340B, and they've started this big effort to oppose the bill there. And then there has also been another dark money group called Community Action for Responsible Hospitals that has run some ads in local publications, also opposing this bill and criticizing hospitals' role in the 340B program. The reason we call both of these groups, Building America's Future and Community Action for Responsible Hospitals, dark money groups, is because they are registered 501c4 nonprofits, and they are not required by law to disclose their donors, and they don't. And so those types of groups are generally referred to as dark money groups because they're spending a lot of money and they can legally spend a lot of money, and they don't have to say anything about who their supporters are. So all of that being said, we had all of this buildup. There's this big hearing earlier this week. There was not a vote on it. So we'll be closely following to see what the next steps are. We'll see if this House bill advances, if the Senate ends up taking this up or pushing for their own version, what happens next, that all remains to be seen. But certainly right now, with a lot of other state legislatures adjourned or out of session at the moment, all of the proponents and certainly all of the strong opponents and critics of the 340B program are very zeroed in on Michigan right now, which very much is in session. So we'll be updating our readers and listeners on that for sure.
And I was going to say, Will, I recall last year it came down to, was it Christmas time when the Michigan bill was about to make it, along with a number of other bills that actually were not controversial, but they couldn't get enough people to show up to work. Do you recall a little background about that situation?
Yeah, basically last year, a bill had been flying through the Michigan legislature, and then there were some budget debates at the very, very end, and there was a big walkout and boycott by certain lawmakers. So they actually didn't end up having enough lawmakers in one of the houses to actually reach a quorum and be able to do and conduct legislative business. So that completely threw off that whole bill, as well as so many other types of bills. And going back to the point about Michigan being purple, it's pretty interesting because so many of these other states we've been following, if they decide they want a 340B bill, they're all in the same party, so they can do it and things can move through relatively quickly. But in Michigan, where it's very deadlocked, very narrow majorities for both parties, it's more similar to what we've grown used to in US Congress, and that it can get pretty difficult for things to get done, and a lot of politics come into play regardless of what bill is in question.
Yeah, it's quite interesting. We'll have to keep a close eye on this. And it looked like, as you mentioned, in the Senate, it seemed to fly through fairly easily with strong bipartisan support. But certainly the pharmaceutical industry has been much more aggressive in lobbying the House, or at least more successful so far in making some significant changes to the bill. So keep us updated on that, Will and Shannon, and I'm looking forward to seeing if any more other state bills pass this year. As you both mentioned, there are not a lot of legislative sessions still going on in states, but I think there will probably be a few more debates before things get really busy again in January. With that, that brings us to the end of today's episode. We'll continue to keep an eye on all things 340B related, and we'll be back in 2 weeks with a new episode. Of course, we will report on anything that happens in the meantime on our website. Please follow along with our twice weekly newsletters. And just a reminder, if you're not a current subscriber, you can take advantage of our 25% discount for first-time subscribers by going to 340breport.com, clicking the subscribe button, and using the discount code podcast25. Thank you for joining us, and we look forward to being back in 2 weeks.